think that there's one biggest mistake that plans make when handling CMS, MSP, and COB and other reconciliation data. It's more that processing these records is just really hard to do. So first, there's this complex web of sources where actionable member data can come from. So most of the reconciliation data comes from the large number of CMS files that plans must be able to accept and then process on a daily, monthly, and annual basis. And then in addition to those CMS files, you've got actionable data that can come from a number of other types of either provider or member interactions, such as a customer service call or a return COB survey. So it's really this myriad of data sources that creates an environment where maintaining data accuracy and taking the appropriate actions can be really particularly challenging. And then second, it's hard to manage this large volume of data. So there's often timing mismatches where CMS lags make it really hard to keep a current and accurate picture of what's occurring with a member's overall profile. And then just the sheer volume and complexity of the data that we're dealing with. There are thousands of data points updating constantly, so it becomes a real challenge to track and reconcile everything consistently. And so, in that sense, it's not always easy to narrow in on which records are actionable and which ones are just noise. And then third, a lot of times the processes and the knowledge bases are not always there. So in a lot of cases, there's still a lot of manual processing of this type of work. Some plans don't have systems that can help them automate their records and store and document all of the different activities that are related to working these records. The processes are not always in place to make sure that the data gets distributed both internally within the health plan and then to your partners external to the health plan. And then finally, some cases are just complex and they really need to be escalated to an experienced processor who can read the marks records, interpret plan code changes, identify and escalate systemic issues, and really spot where a seemingly minor inconsistency might cause a serious downstream effect. So really, to be effective in this area, it's essential that you work each member holistically. So understanding how all of these different pieces of data intersect and what needs to be done to ensure that you're avoiding any type of negative impact for your members, incorrect plan payments, unnecessary administrative burdens and rework, and then of course, audit findings.